Hi, I'm Morgan Fitzgerald. I am an acute care SLP at Frederick Hospital in Milwaukee. I have been an SLP now for about 5 years. I started off my career in North Carolina at another level 1 trauma center and really enjoy working with medically complex patients in the hospital setting. So the ages of the patients that we see are typically 18 and above. We can even see patients that are over 100 years old. So we typically see adults. Sometimes we'll have some that are around 16, but mostly the adult population. At a level 1 trauma center, we see all diagnoses under the sun. So we have a trauma ICU where we see some pretty significant trauma cases. We also have a cardiovascular ICU, a transplant ICU, a neuro ICU, and a respiratory ICU as well. We have step-down floors that are floors that the patients go to after they are well enough to leave the intensive care unit. Some of the diagnoses that we see are dementia, we see any type of cancer, we see major cardiac issues, respiratory issues, lung transplant, heart transplant, liver transplant. So we see essentially any potential diagnosis under the sun. So a typical day in acute care is nothing but predictable. So that's kind of one of the draws of acute care, is that no day looks the same as the one before. So if I come in the morning, I might look at my list of patients that are available, and I can choose my own schedule, which patients that I want to see at what time. Typically, I will start my day with evaluations, so something like a swallow evaluation or a cognitive communication evaluation, cognitive deficits or aphasia, and then intersperse some treatment sessions throughout that. Throughout the day, we often are doing objective types of testing for swallowing, so something like a video swallow or an x-ray swallow, or a FEES, where we use a camera to look at the swallowing through the nose. So those tests can be scheduled, but other than that, I have a lot of flexibility on the time that I see my patient and for how long that I see them, based on how appropriate it is for the patient. So some examples of some diagnoses or disorders that we might see in the acute care setting would be dysphagia or swallowing difficulties. We also are involved in restoring verbal speech via a speaking valve device for patients who have a tracheostomy or a supportive breathing tube. We also are assessing and treating cognitive disorders, so deficits in maybe memory, attention, problem solving, also aphasia, which is a language disorder and difficulty communicating. We can also see dysarthria, which is slurred speech. Beyond that, we do evaluation and treatment of sometimes one or more of those disorders, depending on what the patient needs. One of my favorite parts about this setting is the opportunity for interprofessional collaboration. So we work with many other team members who are part of the hospital staff. I connect with nurses on a daily basis, actually multiple times a day. I talk to doctors multiple times a day, nurse practitioners, and physician's assistants. We work with radiology staff. I work with my physical therapists and occupational therapists. We have respiratory therapists that we work with frequently, CNAs, really anyone who works in the hospital we are collaborating with on a daily basis, which makes it a really fun environment because we're all working together to help the patients and to get them better so that they can leave the hospital. So some of the benefits of working in the acute care setting are the pace. It's fast paced, it's challenging, it's very exciting in terms of seeing different diagnoses from day to day. It's never boring. I can say that confidently, that every day that I come in, I have something new to learn, and kind of exciting things to keep up on in the field. I really enjoy the autonomy of the field, where I can make my own schedule. I'm not stuck to a rigid appointment schedule where I need to go and be somewhere at a certain time. I really enjoy the autonomy of the field where I can make my own schedule. I'm not stuck to a rigid appointment schedule where I need to go and be somewhere at a certain time. I also really appreciate the interdisciplinary collaboration working with PTs and OTs and other staff in the hospital. It's really cool to be in this setting and to be able to work as one big team and a group. And overall, I think we can see pretty significant improvements in the disorder areas that we see, because most of the patients that we see here in this setting are pretty acutely sick or newly sick. So when they get better with our therapy and with time, we often see them improve as well. So it's pretty cool to see people go from a pretty impaired state to getting to the point to leaving and going to another rehab or going home potentially. So there's many benefits to this setting, and really it's an awesome place to work. So I would say there are a few drawbacks to this setting. First would maybe be a more non-traditional schedule. So I do work weekends, we work holidays as well. As you can imagine, the hospital is open 7 days a week, 365 days a year. So we need to have staff available for all days, which can sometimes mean that you're working a weekend or a holiday. Additionally, it is a high pressure position, so some of these patients, because they are so sick, the choices that we make can sometimes make an impact, or a pretty significant impact on their health. So it's challenging, and also a lot of pressure to be on the top of your game and keep up with the updates in the field and make sure you're operating at the top of your license. Additionally, I think working with patients, especially in a hospital of this size that's a level 1 trauma center where the patients are pretty sick and there's a significant amount of serious trauma that we see, the emotion or the seeing these patients can sometimes be a little bit emotionally taxing, because you get to know the patients and their families, and you're essentially seeing them sometimes go through some of the most difficult times of their lives. And sometimes you can see setbacks in their medical status, and things go just the way that we don't expect them to go, and it can be a little bit hard to watch at times. So there's many positives, but also drawbacks, just like any position that you're in. Some qualities that might make you successful in the acute care setting are: number one, flexibility. Because like I've mentioned, with the schedule and the autonomy, you have to be able to kind of switch on a moment's notice, and if you have a plan set, you might not be able to follow through with that plan, so you might have to just rearrange. So that flexibility is really important. On top of that, communication is also important. When you're working with many members of the team, being able to communicate with them efficiently is really important for you to be successful. Additionally, motivation for the field and passion for the field is really important. Wanting to keep up on the newest and latest, greatest practice patterns in the field and evidence-based practice is so important. So all of those qualities can really make you successful as an acute care therapist.